Hello, my name is Amisa Rashid, a 2023 East African WomenLift Cohort leader and a counseling psychologist, a mental health practitioner by profession. I am the founder and executive director of Nivishe Foundation. Nivishe focuses on building community-based mental health interventions, innovations, and approaches by offering cultural sensitive, affordable, and accessible mental health services at the community level. So apart from the work that we do at Nivishe Foundation, we are basically focused on how can we localize and decolonize mental health, because most of the time we find that our mental health approaches in the African context is borrowed from the conventional Western approaches. So how can we localize it? So that is what I do with Nivishe Foundation. Apart from that, I sit in several global and local boards. And one of the projects that I'm also proud of is being the co-founder of Da'wah Counseling Center, which is a conducive environment, safe space for Muslim women to come and gain mental health support within the confinement of the Islamic Sharia, which actually has been successful and has actually led me to develop my leadership project. So my leadership project within the Women Health Lift group was to create a fellowship program which will empower Muslim women in the health field to cultivate their leadership potential. And the context is from my personal experience. I've not only come from an ethnically marginalized Nubian community, I have been in the health space looking for Muslim mentors who can nurture, support my leadership journey, which is easier because of the aspect of representation. And sadly, Muslim women are not actually are underrepresented when it comes to healthcare leadership, and it is hindered by a lot of existing barriers, including cultural and religious barriers. And the purpose of the fellowship was not only to network and to create a community, but to cultivate confident Muslim women leaders who will break down barriers and promote diversity in healthcare, so that even if it's a young Muslim girl at the community level, will see a Muslim leader and through the power of representation envision themselves and know that they have the ability to be the said Muslim leader, to be the said leader despite their religious, economic, and cultural background. So what have I done? What were the intervention within my leadership project? So we developed a comprehensive leadership curriculum tailored for Kenyan Muslim women within the health field that is within the Islamic confinement. So that means that making sure that we're just Sharia based, so that somebody, a Muslim woman, will not say that I'm not going to that essence because it is not it does not cater to my Islamic needs. And then establishing a mentorship program that connect participants with experienced healthcare leaders to learn with, to learn from, to collaborate, and to resource share, apart from experience sharing. The other aspect was creating a network to foster collaboration among Muslim women within the healthcare profession, which will lead down to breaking barriers and to promote diversity and inclusivity, especially also for women in marginalized communities like mine. And as you can see from the photos, like even if you come from a background that it is not known, through education, mentorship, and guidance, you will end up being a confident Muslim woman, which I am a good example of. So what are the ongoing, where are we currently with the project? So one thing that I'm really proud of that actually came from this project was because of the work that I was doing in this, Jamia Mosque, which is one of the largest Islamic institute in Kenya, actually approached me to spearhead and roll out its first ever mentorship program for the Muslim youth. So that gave me an opportunity not only to have access to these Muslim leaders in the healthcare space that I did not have access to before, but also gain a lot of resources from the Jamia Mosque, like making sure that I've partnered with them, aligning, branding both mentorship, the Jamia mentorship program and my project within the Women Lift Health actually helped me gain a lot of actual understanding of what the Muslim community needs. Resources utilization from Jamia, because I had access to the radio channels and television channels and newspapers just to talk about the work that I'm doing, a lot of airtime and credibility, which to my name and to the work that I do, of course, even to Nivishe Foundation, and initial participant engagement, which we did our first convening within the Muslim women space. So what has the whole thing impacted on my leadership journey? So one thing is that currently I'm representing Nivishe in the technical working committee to develop its the first ever mental health action plan from Nairobi County. Yay, that's a big thing. The second thing is that I've got several leadership positions. I have been appointed by Aga Khan University, the Brain and Mind Institute, to be among the community advisory board members. And our work is basically to find ways to localize scientific researches, because yes, there's a lot of scientific research has been done around health, but is there somebody or an organization or individuals who can make sure that the findings can reach the local mwananchi at the grassroots levels in such a way that it can lead to behavioral changes? Due to the confidence, the growth as a leader that I've gotten to Nivision, that I've gotten from the WomenLift program, I've been able to increase funding for Nivishe Foundation, and we're building the first ever mental health center in Kibra where we operate. So yes, so that's a plus for me. And then one thing we are really keen on at Nivishe Foundation is to develop a community-centric research approach, whereby we want to be producing our scientific journals, our evidence-based mental health approaches from the community level, but using research. And that is why we ended up establishing a community-centric research department, which I am so glad of. As you can see, this is me. This is a photo of how I envisioned myself to be, like a confident, positive leader who can be able to speak in front of women. And through the whole leadership program, plus my personal journey, I've been able to achieve that. So yeah, kudos to Women Lift Health, and thank you for your time.